We have one other user experience to talk to us about today. Dr. Matthew Mueller will be speaking to us, so please come on down while I'm introducing your somewhat long title. Dr. Mueller is the infectious diseases consultant and hospital epidemiologist here at St. Mike's, as well as an assistant professor at U of T. So welcome, Dr. Mueller.
Great. Well, I just wanted to thank the HandyAudit team for the opportunity of speaking today. We've been using the HandyAudit tool. I'm not sure exactly when we started using it, but for several months. But it was only as of October that we switched completely away from the paper form, and we've been using the HandyAudit exclusively from the beginning of October. And I think I was trying to think how to present in 5 minutes really what this means for our monitoring approach at St. Mike's. And I realized the best way of doing it is to go through what we were doing before HandyAudit and now how the process works with HandyAudit. And then I think it's really easy to see where the differences are. So the way that things worked before is that we had about 6 different infection control professionals and 1 or 2 nursing students or part-time hand hygiene auditors who were filling out paper forms on a variety of different units. Those paper forms then would go to Noreen, who is our hand hygiene coordinator, who would look at them and make sure that they'd been filled out completely incorrectly. That would get passed to the infection control secretary, Shameen, who, when she had the time, would enter them in batches into a spreadsheet. And then eventually they got downloaded into SAS, where I would do some analysis and try to provide quarterly reports to the hospital on hand hygiene compliance and try to break it down a little bit by unit and so forth. Since we've switched to the HandyAudit system, a number of things have changed, and so we can look at it at each level. So with the actual people that are doing the bulk of the auditing is now, we have 2 part-time auditors who are using this tool. For them, this transition has been very easy. They were trained right away in the HandyAudit tool. They didn't have a huge experience going back, I think, with the paper tool, and I think they found it to be much easier, very straightforward, and as has been mentioned very frequently throughout the presentation, they're basically putting in what they see. One caution with the ICPs, some of them had many years of experience with either the ministry paper form or before that sort of customized St. Mike's paper forms, is there is a difference in thought process. And so there was a little bit of frustration among them just at the very beginning, because there were certain things that they would see but forget to enter. So really that's really a key point when you're first starting, is you really need the training of each auditor that's going to be using it, particularly if they're very well versed in the paper form. So for example, they would see somebody coming down the hallway touching all kinds of things, but they were never recording any observations until that person went into the room. That can actually affect their compliance with the HandyAudit. So that was just a small training piece, and I think that was the main bump in the road that's now been overcome. So the auditors find it much easier using the HandyAudit tool. Then the next step, of course, is that the data is downloaded. So we've now eliminated several steps. Noreen doesn't have to check to make sure that the form has been completed completely. Our secretary, Shameen, doesn't have to enter the data. And actually, even months later, I would pull up forms that would say things like, non-compliant with hand hygiene, used alcohol. And I'd try to figure out, how did this happen and what does it mean? And now we can see that right away when there's errors that they come up on the system right away. And basically you can avoid most of those errors through the HandyAudit system. I'll give 2 other examples of things that came up doing it the old way that no longer happen. So one was we had a relatively new ICP here from another, she was a senior ICP at another institution. She started here. She appeared to be adequately versed in the 4 moments of hand hygiene and very comfortable with the ministry form. But after 3 or 4 months of her collecting data on her units, we noticed that the compliance that she was recording was about 8%, whereas the compliance that all of the other auditors, they fluctuated, but they were typically like 30s, 40s, 50s. So there was something really different going on. And we went back and we grilled her several times about the 4 moments, and again, she gave the same answers that everybody else gave. And then we realized what the key issue was. So she said that if somebody washes their hands for only 8 seconds, that's non-compliance, right? So she was just if she saw somebody approach a room, pump the alcohol, wash for 8 seconds, and then enter and test the patient, she just put no hand washing. Whereas the others would record hand washing by 8 seconds. And the difference, of course, with the HandyAudit is when you find those discrepancies, you can understand what's happening. The results would be the same now, the way that she did it, or the way that the correct way of doing it, if I'm making myself clear, because you push wash your hands and then you push stop washing and it would say 8 seconds. And anyone could decide later on if you wanted to not count those or count those across all of the different HandyAudit systems, right? So you're able to compare between between one and the other. So unfortunately, in this case, we had to go back and throw out all of our audits because they were done inconsistently with how the rest of our hand hygiene auditing was done, which was at that time, we count any hand hygiene even for 1 second counts in our compliance monitoring. So we look at time, but we count everything that's done regardless of how long it took. The HandyAudit system would allow us to change that too. So if next year the ministry said, no, we're not counting hand hygiene unless it's done for the full time period, you could go back and calculate your compliance retrospectively depending on the time, for example. Another example of what came up was I was training a hand hygiene auditor. We both observed the same thing. So what one of us observed was a healthcare worker that approached the room, washed his hands, went into the room, had an interaction with the patient, left the room, washed his hands down the hallway. So one of us gave them 2 out of 2, 100% compliance. This is what the other auditor observed. The healthcare worker came down the hall, washed his hands, went into the room, touched the bed rail. The patient said that the room was too hot and could he turn the fan on? So he sort of went off to the side of the room, just outside the privacy curtain, turned the fan on, and then came back in and then touched the bed rail again. Then the patient said, actually the fan is too strong, could you turn it down? He went back and he touched the fan, he came back and touched the bed rail, and then he said, it's too loud, can you just turn it back off? And he went back and touched the fan, and came back and touched the bed rail. And that, so one of the auditors gave them, I think it ended up being sort of 2 out of 16, so less than 10% compliance. And still to this day, actually, I'm not 100% sure which auditor was correct, and it really depends on how you determine what the patient's environment is. But the fact is, when you saw the 2 sheets afterwards, there's no way of making any assessment, the 2 paper sheets, about what happened. But with the HandyAudit system, you can really understand what happened and why there was this discrepancy, and then you can resolve it one way or the other. So you always have that record of exactly what happened. So really, those are some of the advantages that I see at the level of the auditors and at the level of training auditors as well. At a higher level, we get a lot of requests now from different groups at St. Mike's who are interested in accessing the hand hygiene data for their own purposes. So in the last month, I was asked by a physicians group, what's the compliance of just physicians across the institution? They wanted to put it on the MAC scorecard for physicians looking at compliance. We got a request from a respirology unit. Could you tell us what our compliance is before and after an intervention that we've launched to improve hand hygiene? And we get a number of requests like that. The environmental services group wanted to look at using hand hygiene among environmental service workers as a metric, and they had some specific questions about that. In the past, I was the only one capable of generating some of these reports, which are actually quite small and simple, but with our old system, required sort of reprogramming and a lot of work to get that type of report out. But now anybody on the hand hygiene team is capable of printing out those simple reports and being able to get that feedback back to people who may be interested in hand hygiene for only 15 minutes of their whole life and don't have the patience to wait 3 months to get a report for you, really has an impact in empowering them to improve hand hygiene on their units and in their environment. So I think that the strength of HandyAudit is really at all levels. It helps train auditors, it helps standardize auditors, it helps generate reports in a timely manner. And it's also going to allow comparisons between hospitals. And so the last example that I'll give to you is, I did my training at Mount Sinai Hospital, and I'm also in contact with a number of infection control professionals and directors across the city. And we had the issue here that we didn't even realize it was a potential issue until we started using the HandyAudit, which is the whole issue of how do you view a healthcare worker before they've entered the room. So at St. Mike's, our practice has always been, if you don't see them wash their hands before they enter the room, you assume that their hands are dirty. And this is our interpretation of what the ministry requirement was. But when we spoke to people at another hospital, they said, no, that's completely wrong. You have to assume, you can't judge them on hand hygiene if you don't know what they've done. So unless you see them touch something before they enter the room, you can't assume that their hands are dirty. And that's exactly what the ministry says. So I thought, oh, that's interesting. Let's switch to that way of doing things. But I also realized that would change our compliance, right? But not a real change, but a change in at least the numbers that we're going to report. So I decided I better check with a few other hospitals. And everywhere I checked, I got one of the 2 answers. And everyone was 100% convinced that it was mandated by the ministry, right? So there's still a lot of subjectivity and a lot of confusion in hand hygiene recording. And it would be a shame to find out that we've been doing it wrong for 2 years and that all that data is no longer comparable to any data going forward. But now that we're using HandyAudit, we can flip-flop on that decision. So we can decide one day that we're going to do it one way, and then in 6 months flip back the other way. And there will be ways in HandyAudit to reanalyze the data and say, okay, if we assume that this is the correct way. What would our compliance have been using the HandyAudit data? And if we assume the other way, what would it be? And that may also allow us to determine whether differences between hospitals are related to differences in how this is measured or actual differences in compliance. And it's not just a matter of, my hospital is better than your hospital or my hospital is worse, but we really want to be able to identify programs and strategies that are successful at improving hand hygiene. So we can measure it in a way that's standardized and accurate. We won't really know whether the 90% compliance at one hospital is due to a different measurement methodology or due to a really robust and excellent program of hand hygiene promotion. So I think the HandyAudit is a small step in the direction of being able to actually compare data across hospitals as well as improving to a large extent how hand hygiene is collected within the hospital. And I think I'll stop there and take any questions that anyone has. Okay, thank you very much.
Thank you. I think it's great to hear the first-hand experience as some of the rest of you are going to start diving into this, and certainly eyes opened on some of the issues that maybe were unanticipated. So thank you for that.